Hello, welcome to this podcast from Two Peas in a Pod. I'm your host, Ian Lewins, and I'm very pleased to be joined this evening by Jessie McCulloch, who's a health visitor, a children's nurse, and most importantly, a lead practice educator with the MeFirst project. Good evening, Jessie. How are you?
Good evening. Very well, thank you. And thank you for inviting me.
Oh, thank you so much for coming on. It's a real pleasure to speak to you. Well, let's dive straight into it then. You're sort of one of the lead people with the MeFirst project. Can you tell us, sort of in a nutshell, what is MeFirst?
So it's a project which is really around an education and training resource for healthcare professionals. So it started about 5 years ago, really focusing on the experiences of children and young people in hospital and what can be done in terms of communication to improve that experience. So we offer a website, Twitter chats, and different training days, really focusing on some of those conversations that clinicians will be having in practice and what we can do to improve that.
Okay. And how did you sort of get involved in this?
So I heard about the project probably about 3 or 4 years ago. I was a Darcy Fellow at the time and working on workforce issues for nursing students in children's areas. And I was aware that it was something that was coming up a lot from my role as a children's nurse lecturer and in my experience of delivering care as well, that often we had conversations with parents and the children were often not involved in those conversations and perhaps were becoming slightly disengaged. And it really felt like an opportunity to start to change that relationship and think more about what children and young people are needing.
And as you say, is that something that in your clinical experience, something that you recognised and wanted to kind of get involved in?
Yeah, I guess for me as a health visitor, I was often working with very young children, but I'd always felt it was important, even with 2, 3, 4-year-olds, to talk to them about what was going to happen and ensure they understood, even if it was giving an injection or taking their weight, in a really simple way what that meant. And from a personal level in different areas that I was involved in, I could see teenagers were sometimes not involved in those conversations and were not wanting to speak to medical staff or not going to appointments regularly, and this was having an impact on their health. And what could we do differently?
And I know the answer, I suspect, but is this sort of something that's recognised nationally, globally, that children and young people are often excluded from these conversations?
I think from a national perspective, this was part of how the project originated as well. It was when the CQC started with the national inpatient surveys, and it was back in 2014 when it was showed that over half of children and young people were saying they weren't involved in conversations about their care. They didn't always understand what was going to happen next. They most of them said really positively about feeling that they were well cared for, but not necessarily the full picture or feeling included. And certainly from an international perspective, that's reflected in the literature in many, many different countries and often specific clinical specialities. So there's various research being done on children with cancer and their experiences of care or long-term conditions like diabetes as well. There's quite a lot of research into those areas internationally. So Health Education England said, what is it we can do to start to address this? And this was where it came that a training course could be a way of managing that from a workforce perspective. It was going to be interprofessional, so it wasn't a specific group of clinicians that were targeted. It was trying to use that opportunity for people to learn from one another about what they were doing and what they might want to change.
Yeah, and certainly, from my perspective, in dealings with the Royal College of Paediatrics and Child Health, this is something that's been sort of noticeably driven over the last few years, and things, there's nothing about me without me, and trying to actually refocus people on, your patients, and often we deal with the parents and sometimes miss the patient, don't we?
Yeah, I think there is that real risk. And often, you've got a parent coming with so many concerns and issues that it's really important to address. And I think some people, especially with the name MeFirst, see it as it somehow excluding the parent. But actually, that conversation needs to be including everybody, all the caregivers, and ensuring that that communication is not necessarily even between the clinician, the parent, the child. It's also thinking about the wider network of people involved in that care, and how are we facilitating that choice and decision making so that people feel more empowered to manage their care as they go into adulthood.
So if we sort of think about the resources and MeFirst, I mean, the first thing to say is in your experience, how do people access these resources?
So I'd say probably the biggest access for the project has been our website, and that's been growing and growing year after year. We have sometimes over 2,000 hits a month. We have gathered resources from all over the country, and some are international as well, of different tools or videos or information that we think are really useful for having conversations with children and young people. So we've got all sorts of topics on there. It can be around a series of questions to think about before they come into an appointment. It can be some visual aids about having a blood test. It can be a short video about what happens when you have an MRI. And there's lots and lots of different things, and some of them they can be printed out from the website and used in your area, or some of them are really lo-fi or low tech rather. It's just some little scribbled images that people can use as a sort of sorting technique, which can sometimes help, particularly if, say, a child or young person isn't particularly talking that much.
Okay, and that website is mefirst.org.uk. Is that right?
That's right. Yeah.
Okay, and I mean, what do you feel are the sort of core principles behind this? I mean, you say there are the resources there. What would you have as your core principles in this?
I think fundamentally it goes back to the UN Conventions of the Rights of the Child, and it's about that child having access to information, I think, is part of it, and having their voice being heard. And I think we, as a country, we really believe in that, but sometimes things get in the way. We are very time pressured in a clinical environment. We've got other people's concerns that need to be addressed. We've got a checklist of things that we're thinking about that we want to cover when we're talking to a child and their family. And sometimes those extra bits are considered forgettable, or we can leave those to somebody else at another time. But actually, those bits are really fundamental to, if we are demonstrating that compassion, that empathy, that listening, we are seeing that person in a much more holistic, human way, and much more likely to get to know them as an individual.
Yeah, and I mean, are there particular sort of groups of patients and children and young people that present particular challenges in your experience?
Oh, definitely. I'd say that there are so many different aspects, and that I've experienced personally as a children's nurse and as a health visitor, but also what people have brought to us through the training that we deliver. So I think the topics of conversation often people are really nervous about are around going into adolescence and transition, and talking about things like sexual health, or drug taking. Lots of people find it really uncomfortable talking about weight issues, and how
Yeah,
do you open up that conversation, because weight is such a stigmatized subject, and people feel very strongly about it, or stigmatized about being overweight, that actually how do you open up that conversation. I think another one would be around when you've got that kind of hunch that something's not right, that there may be a risk to that child. I certainly came across it working in sexual health clinics and seeing teenagers and young adults coming in where you weren't sure what had been the background to bringing them in, but you felt that something wasn't quite right. And how do you have that conversation to help them feel safe and ensure they're getting the right kind of support? And I think that can apply as well to some conversations about mental health and well-being too.
Yeah, and I think certainly from my experience, it's as a paediatrician of 20 years, it's often the teenagers that I find the trickiest to talk to. But actually, I think from an emergency perspective, often people coming into doing paediatrics for the first time find, I would say, even the younger children actually far more challenging. The 3-year-olds, 4-year-olds, if they haven't sort of got kids of their own or experienced it, actually they find talking to them very challenging.
It's that trying to find something in common part, I think, or something that is sufficiently distracting. And I know, children can be the hardest audiences sometimes, and can be very blunt with you, very critical. I know I was talking to a young person, she was 8 the other week, and she just went, "Yeah, that's a really nice story." And you're just like, "Oh, thanks." But they can bring so much fun to a situation, and I think that's what I love about working with children and young people, that you get to be more creative, you get to play different roles in how you communicate with them, and that isn't necessarily easy at first. And I'd say especially for people that may not have had that much experience, watching TV shows is a great way of coming up with characters or lingo that they'll be familiar with.
Yeah, and it's sort of one thing that I'd always encourage my medical students who've often got very little experience of children is just go and watch CBeebies for a couple of hours, and you'll get a great deal from that for your younger patients.
Absolutely. And it's fun.
Yeah, well, some of them are. Some of them are, actually. So looking on the website, it talks about the MeFirst communication model. What's that about?
So the way that we started the whole project was to undertake a literature review on what was already out there. And a lot of the literature came around specifically decision making, and how that was undertaken, and what were the important things that children and young people wanted as part of the conversation. So we encompassed the literature review with a number of focus groups with children and young people from all across the country, and talked to professionals as well about what they found was effective, or the challenges that they'd had too. And the communication model embraced all of those aspects and effectively became a framework for a conversation of the really key important things that wanted to be included. So it's from how you go about doing introductions to how you focus what the specific topic you are going to talk about in that conversation is going to be, to how those decisions would be made and how that would be followed up in the future.
And is this sort of this? Actually, this is mostly done online. Do you guys do any sort of face-to-face work at all?
So we go out and do training all across the country to groups of clinicians and introduce the model in more depth. So we give everybody the opportunity to come up with a particular situation that they find challenging. And then we draw on what commonalities there are with the people in the room, and we undertake a big role play situation of thinking about what would we include in that conversation? What are the specific words, phrases, tools, or activities that we might want to use to have a more effective conversation? And then that gives them a chance to know what feels right or what doesn't feel right, because we know when we try to do things differently, it's always a little bit uncomfortable at first. And practicing that, all the research shows that makes it easier when it comes to facing that situation in real life. So one example was a clinician was running a regular clinic where a number of children and young people were coming who were likely to face a diagnosis of a life-limiting condition. And so there's a lot of resources and ideas about how to manage that aspect of the conversation. But even before that, how would you talk to that child or young person about the tests that they were going to have, how they would like to receive the diagnosis, or the results of the test, as well as the kind of implications that was going to have for them. So it gives you an opportunity to really break it down into very, very small chunks, which can be really helpful for thinking about how you manage things in a different way.
Yeah, I think, I mean, for those examples, that specific example, it's you only really get one chance to get that right, really. And the particularly breaking bad news is something that I think a lot of clinicians feel very concerned about, and getting it right is so important.
It really is, and I think we all know that there isn't going to be a perfect conversation. We can do our best, and that's why it's really useful to have that chance to practice, or to use the model as a reflective tool to think, okay, what went well today? Was there anything I missed in this conversation that could have made it better? And to also learn from other people. I think that's what we really find in the training, is it's also hearing from other clinicians about what worked for them, because I know when I've been going out and trying new things, it's taken me hearing lots of different people's styles before I felt that something that would fit with me or that I'd feel comfortable with as well.
I think looking on the website, the other bit that really interested me actually is this, and I think again something that people found particularly challenging is this conversations about concerns model. Can you tell us a little bit about that?
So that came about some work with NHS England, really around how we have conversations with children who are at risk of sexual exploitation. And it was my co-lead, Kate Martin, that led on that, along with Dr. Duncan Law, who works with the Anna Freud Centre. And so they did a lot of research and focus groups with young people about how we have those kind of conversations. And I think what's really key there is that kind of open honesty and recognising that, there isn't a magic fix here. It is about how do we figure this out together, and that partnership with a child or young person, so that they're not feeling that you're telling them what's going to happen. It is particularly, I think, when children have been at risk or are very vulnerable, already so much control has been taken away from them that as a clinician you have an opportunity to help give them some control back in terms of what information is going to be shared and how it's going to be shared, because that's the bit that I think people are really terrified about. Who's going to know about me, and is everybody going to be told, and what's going to happen next?
Yeah. And these are, I think experientially, these things, these conversations, these difficult conversations are so important. To play devil's advocate slightly for a minute, somebody might say, well, it's all very nice, but does it really make a difference? Does it really make a difference?
It's really hard to prove very categorically what makes a difference. But we know that, particularly around transition, for example, young people rather, who have been very engaged in their clinical care, if they change to a different team and don't feel comfortable with that team, they're far less likely to go to follow-up appointments. So we often see a huge deterioration of health around that transition period, and that's fundamentally about communication. And young people, what they've told us is this really, really makes a difference to them. They have felt that it's been transformative when they felt that somebody has listened to them. In fact, I was teaching a group of professionals this week, and one of the things we ask people to do is think about a good experience of care that they've had. And one of the participants actually became very emotional, recalling an occasion where she'd felt really listened to by a professional, and it had been the first time she'd ever experienced that in her life. And she said it wasn't about what they did or what they managed to achieve for me. It was just about having felt listened to. And I think that we sometimes underestimate how powerful that is.
Absolutely. It's interesting with you sort of saying that. Is this training, obviously anybody can access the website, but is the training that you offer open to all healthcare professionals, not just sort of doctors and nurses?
So yes, we open it up to healthcare assistants, allied health. We have had reception staff attend some of the sessions, play therapists. We encourage anyone that's having conversations with children about their health or well-being to come along, and that's dependent on which trusts invite us in. So we're happy to travel wherever. Depending on what the need is in that local area. So some of our work is commissioned nationally, some of it is trust by trust basis, some it's smaller teams.
And who funds sort of MeFirst, and who funds your training?
So originally we were set up and funded by Health Education England, and now we're in a phase of being self-sustaining. So we keep going through our training that we deliver. Okay. So that's usually funded either by STPs or CCGs or local trusts, or as I said, NHS England have commissioned us to do bits of work as well.
Okay. So if I have a health professional who's sort of listening to this podcast and thinks, actually, that's something that we perceive as a something that we could do with locally, but we don't really have that training, what would you recommend as sort of the next step of getting started?
Do get in touch with us. So we do offer some open access training. So for individuals that want to come along, we offer that in London. Or if there was a team who would really like us to come out to them, we could talk about what some of the funding streams that might be available to them locally that we could tap into, whether it's a local charity or whether the STP might be able to align it with some of their strategies locally. So do get in touch, and it's info@mefirst.org.uk.
Okay, and I guess as we said the website's a great place to start as well, just to sort of see what's available.
Absolutely, there's lots of different things that people can have a look at and get an idea about, and we're trying to add to that all the time. So if anyone's got any good ideas, do send them our way because we'd love to include them.
Absolutely. And I guess my final question then is given where the project's at the moment, what's for the future for MeFirst?
It's a very interesting time, and it's hard to know exactly what will come next. I think it's tricky because we recognise that CPD funding is limited in a lot of areas, and are there opportunities to think about how it works with specific targets, for example, around urgent and emergency care or around cancer care, rather than making the generic training that we offer at the moment. Whether there's more room for digital training. I think it's tricky when it's communication, but I think there is certainly a place for some of that, and how people might be able to access that more easily. I think free PhonePed is brilliant, and I really encourage that. But I think also when we're talking about communication and some of the tricky conversations, there's such value in having that face-to-face. But is there a way of allowing small teams to take things off our website and use that as part of their local training? I don't know. Watch this space.
Excellent. Okay, just to sort of reiterate again, it's mefirst.org.uk.
That's right. And we also have Twitter chats every 2 months. Our next one is on the 11th of September. And that's going to be about challenging professionals.
Okay. And what's the Twitter handle that we need to look out for there?
@CYP MeFirst.
Perfect. Jessie, that's given me so much food for thought. Thank you very much for joining us today.
Thanks for having me.